Hi everyone, I'm Dr Yusra. Today I'm going to answer your skincare questions. So let's get started. Okay guys, so you sent me some of your questions on Instagram and YouTube, and I'm going to start answering them now. So question number 1, what treatment for malar bags or saggy skin from having filler dissolved? I'm coming to see you soon. So this is a question from the lovely Laura. Laura, we can't wait to welcome you. Now, malar bags are, again, a term that sometimes is confused. So some people have a line that goes across the midface that comes from the inner corner of the eye down the midface. That's called a malar groove. And biologically and medically, we call this a nasojugal groove. And lateral, which means outer, from the outer aspect of this line, you can sometimes get puffiness, and that puffiness is called malar edema, which can be made worse if you have dermal filler. A malar mound is something that you have congenitally. That means it's hereditary, it's inherited. Your mom might have had it, your dad might have had it, and it's got nothing to do with filler, so to speak. But again, it's something that can be exacerbated with dermal filler. It might be fat, and it might be fluid. And which one is something that you will have to have an assessment to be able to diagnose, choose the right treatment to help. If you had filler that made it worse and you have had it dissolved and you're now left with a bit of a sunken area, then I would suggest tightening up the tissues. And you can tighten up the tissues with microneedling, with radiofrequency microneedling, or even with a laser. And it doesn't mean you can't have filler placed again, but the most important thing is that you have filler placed at the right layer, which is deep onto the bone and never in the superficial plane, because filler in the superficial plane will suck water in and hold water in, which can make puffiness worse. Next question. I have a lip lift scar I hate. It makes me hate seeing myself in the mirror. Any suggestions, please? If you have a scar from a lip lift, sometimes this is done where they cut the actual lip line, and sometimes the cut is just underneath the nose, and it can be prominent and really impact people's self-esteem. With any scarring, one of the most effective treatments is microneedling with laser. And depending on your skin color, you can either have a CO2 laser in combination with microneedling. And the best form of microneedling is radiofrequency microneedling. Radiofrequency microneedling uses heat to deliver heat energy to the tissues alongside the trauma from the micro injuries created by the microneedles. This stimulates new collagen production. And then the CO2 laser can almost sort of file down the scar to make it less obvious. But if you are skin of color and this is not suitable for you, then you can have a different type of non-ablative laser called an erbium glass laser. This also delivers heat. This also helps to remodel scars, but it doesn't burn the upper layer of the skin, which means you're much less likely to cause a secondary issue like post-inflammatory hyperpigmentation. Now, which treatment is right for you will depend on a consultation, so get in touch if you want personalized advice. Right, next question. Best treatments for acne scarring post-isotretinoin. So first of all, congratulations that you have taken medication. Your acne is no longer an issue. Isotretinoin is also known as Roaccutane. This is prescription-only medication that helps to treat acne that can be persistent or cystic acne. Now, if that's gone away and you've been left with scarring, then we've done a whole podcast on acne scars. One of the most effective treatments, again, is radiofrequency microneedling to create micro injuries, stimulate new collagen, and reduce the appearance of the scar, alongside laser to resurface and improve and remodel the tissues. But sometimes that's just not enough. And I often combine with the radiofrequency microneedling a treatment called subcision. So subcision is where we take a tool and we put this underneath the skin to release the scar. So when you have a scar, you often have hard, tough strands of tissue called fibrosis that pull the scar down to the underlying layer. And this can create this kind of hills and valleys and shadows along the skin, which makes it look uneven. A really effective treatment that I would love to have done myself, because I've got acne scarring, is subcision. Subcision is something I do on a very regular basis for my patients, where we take a tool, and this can be either a very fine blade or a long microcannula or a needle, and we break up that scar tissue so that the scar is released and pops up. And I often combine this with either a hyaluronic acid gel to act as a spacer between the skin and the underlying layer, and this hydrates the tissues and plumps up the scar, and it improves the microarchitecture of the skin. The other thing that you can use is a collagen stimulator, something like Sculptra or Radiesse Wash, which is a poly-L-lactic acid or a calcium hydroxy acid. This stimulates new collagen and it plumps up the tissue, and it's a very effective treatment for acne scarring. Next question, best skincare for under eye wrinkles and mature ladies. Also, best facials for dry, mature skin. Okay, so if you've got mature skin, often this is a woman, so this is as somebody who is maybe postmenopausal skin usually is depleted in collagen. You lose about 30% of your collagen in the menopause. And this means that you might start to notice deeper lines and wrinkles. You might also start to notice dehydrated skin and sensitive skin that isn't actually able to tolerate more invasive procedures. So you've got to treat it with care. But you also want to prevent further damage. So number one, skincare under the eye area, I would say for a mature lady, I would definitely incorporate a low-grade retinaldehyde. So this is a retinoid, so a vitamin A, that is not as strong as a prescription grade, but is strong enough to create cellular change without the irritation that a conventional retinoic acid can cause or tretinoin can cause. So retinaldehyde stimulate collagen, they plump up fine lines and wrinkles, and they really help with the under eye area. I would also say that it's really important that you hydrate the area. So you want a cream with ceramides and humectants to hydrate and plump the area, and also act as a barrier. Things that have glycerine in it, ceramides, fatty acids, cholesterol, and also something like shea butter or mango butter to hydrate the skin. In terms of best facials for mature skin, again, this depends on what you want to achieve, but I would suggest that you start to consider things that are collagen stimulating. So if you can't tolerate the more invasive radiofrequency microneedling, then perhaps you can have microneedling on its own, which is a very effective treatment, and I've done a whole video just on that. Next question, more info on medical grade skincare. The terminology medical grade skincare is loosely used, and it's really, I think, confused. A lot of people who don't offer prescription grade skincare use the term medical grade skincare, and I think it's used as a tool sometimes to sadly manipulate the public to think that they are getting something that is prescription grade from a medical professional. So the terminology medical grade skincare doesn't actually mean that much. It's not a regulated term. And what I would say is there is a difference between over-the-counter products that are non-prescription and prescription products. So prescription products are products that can only be dispensed and prescribed and are prescribed bespokely for you, that have strong ingredients that are licensed to create a clinical change and to treat a therapeutic and to provide a therapeutic benefit. So if, for example, you have a pathology, say hyperpigmentation, or say acne, and you want to improve the skin, you can use prescription grade products that have strong ingredients at a dose that is clinically proven to work, but it's got to be done under the supervision of a medical prescriber. Over-the-counter products are products that you can buy from anywhere that don't necessarily have a clinically proven dose to create cellular change. Medical grade ingredients is a term usually used to denote the use of an ingredient that is a cosmeceutical, which means it's over the counter, but it has active ingredients that have, to a certain extent, been proven to create some form of change. So it's a very loose term. It doesn't mean a heck of a lot. And I would say the most important thing is that you're not trying to buy individual ingredients and trying to self-diagnose and self-treat your skin. Do get professional advice if you're suffering with any skin issue, so that you can have a skin specialist choose the right product and guide you to use the right ingredients for you, because sometimes unknowingly you might use two ingredients that cancel each other out, and then you're wasting your money. Last question, do I do online consultations? This lady is saying she's not based in the UK. Yes, we do offer online consultations. You can go to our website, www.dryusra.com, click on book now, and you can book in that way. I hope that helps. I look forward to welcoming you in clinic. We can assess and we can treat you. If you have any skincare questions, feel free to leave them in the comments and I'll try to respond to them. I've loved answering all your questions. If you've liked this episode, then don't forget to like and subscribe, and we can do another one of these if you want to see and hear more episodes like this.